This will be your guide to SimChart for medical office procedures with software applications at National American University. I will be posting the link to the main page for Evolve. Evolve gives you resources for not only your textbooks, but also gives you access to SimChart. Following this link will take you to this page, and you will, in the upper hand corner, be able to click Log In. And using your username and password, you will be able to log in to access your SimChart. If you have not registered for your SimChart, yet you have your access code, right here is where you will redeem your access code, and then you will create your username and password and be able to get access to SimChart. So once you are logged in to SimChart, here we go. Yours will look like this. This is the student side of your SimChart back office in Evolve. So on the left-hand side, you have the top for your course content, SimChart for the medical office. This will take you to the SimChart course. This is your student resources. If you have not access to these student resources prior to, I highly recommend that you go and review all of them. It has quick tips for getting started, talks about the modules, your simulation playground, some frequently asked questions, and most importantly, the medical office workflow. So I highly encourage you to go ahead and open your quick tips and review all of these prior to starting this course. This will tell you, first of all, to familiarize yourself with these student resources and review the assignments. This tells you how to access the simulation, to save your work, and to make sure that you answer all quiz questions in order to submit your assignment. If you do not answer the quiz, I will not be able to see your assignment in grade. It will show in progress on my end. The medical office workflow is the most important part of the student resources. This workflow is designed to help you navigate your simulations. We will be using, I will pull this out here, we will be using the medical office workflow today. So I'm going back to my main, and again, please, this gives you information about the assignments. This gives you information about grading. And then the right side here gives you documents and forms, tells you the ABHES and KHEP competencies for this course, and job readiness. So we are going to click on SimChart for this medical office. This is going to take us to the simulation. Okay, so this here will be your SimChart for the medical office. Your info panel on the left shows your open assignments, your graded assignments, the playground comments archive if I leave any comments for you. So on here, I will go ahead and I will make you a master list and update which number assignments you need to do. For example, week 1, you have to document a phone encounter and order for Charles Johnson, which is number 52. So we are going to document a phone encounter for Ella Rainwater. As an example, once you click on your assignment, you can see in your info panel that your case tells you about the assignment you are about to do. The competencies show you which ABS and KEP competencies you will be covering, and your post-case quiz is what you will take once you complete your assignment. It tells you right here your main objectives are to search for a patient record and document a patient encounter. And so our assignment is, the doctor conducted a bone density test during Ella Rainwater's, and her date of birth is 7/1/59, last appointment, and she is now calling to find out the results. Dr. Martin has not reviewed the test results yet, so the medical assistant takes a message. Ella Rainwater says the best time to return her call is after 1:00 p.m. today at 123-232-5690. Document this phone encounter in Ella Rainwater's patient record and prepare a message for Dr. Martin using the correspondence section. You can print this so that you have it. I like to take all of the key elements and write them down so that they are fresh in my head. So I will write down Ella's name and date of birth and phone number. The message is for Dr. Martin, returning the phone call with the test results after 1:00 p.m. And that my two objectives are to search for the patient's record and document a phone encounter, as well as prepare a message using the correspondence section. So here in the right-hand corner, I click Start Assignment. And remember earlier, we had this medical office workflow. So one of our things that we need to do is document a phone encounter, which tells us we need to look on page 7. So to create a phone encounter, you click on the Find Patient icon. Using the patient search fields, locate the correct patient record. Confirm that the date of birth is correct, 7/11/59. We have the correct patient. And we select her. So you see on the left-hand side under the info panel, we have a button for phone encounter. So it pops up to create a new encounter. So the caller is Ella Rainwater, and the provider is already filled in as Dr. Martin. Patient's name, and the message is patient would like a return phone call with the bone density test results. Best time to call is after 1:00 p.m. today. And I save it, and it shows that this entry was done by me. Now, the record drop-down menu is expanded, but we don't need to do this. We don't have anything to do at this present time, so we can continue on. Now, our next part that we needed to do was prepare a message using the correspondence section. As you see across the top, there is a spot for correspondence, and under the info panel, we have phone messages, so we click phone messages. We must perform, we see this message up across the top here, please perform a patient search to find a specific patient. So, again, we look for Ella Rainwater, confirm that the date of birth matches 7/11/59. When we put in today's date, 9/15/16, I'm going to put 9:00 a.m. for the time. The caller was Ella Rainwater, and the provider is Dr. Martin, and it's a please call. And again, we put patient would like a return bone call with bone density test results. Best time to call is after 1:00 p.m. today. And it was completed by Ashley Bass. And again, it is 9:15:16, and I completed this at 9:15 a.m. And I saved to patient record. And now this phone message has been saved to patient Ella Rainwater record. We have completed our assignment. So in this right-hand corner right here, we click back to assignment. This takes us back to our original info panel to where we can now complete the post-case quiz. And I'm going to jet through these as fast as I can. And now that these are saved, it will pop up and I can click save as many times as I would like, and it will keep doing this. Because now I've completed the post-case quiz and I must submit the assignment. Now, once you submit your assignment, no further changes can be made. My assignment has now been submitted for grading. If I would like to view my graded assignments, I can click on Graded Assignments. And I can see that I received a 100% for my document phone encounter for Ella Rainwater. I will then take this 100% and transfer it into 25 points and enter that into the gradebook in D2L. All of this is done manually, and it does take a little bit of time. If you see your grade in SimChart, I can also see your grade. I hope that this video was able to help you understand SimChart a little bit better, and if you have any questions, please do not hesitate to contact me.